Hello my friend, I'm going to introduce how to operate this L30i for you. First, when we turn on this device, it will recognize the probe that we connected and offer some choices for us. Here we can choose different parts so that this device could provide us good parameters. For example, if I choose bladder, if I need to examine bladder, then I can choose the bladder, and these parameters would be set as these. If in the process of examination we want to examine, we can press the probe key here, press it, and the manual can get back to here, and then we can choose these parts, and also we can build a new selection. For example, we can press here, and then we can name it, and this would be saved. Yes, and this will be saved here next time, and we can choose this. Also, we can manage the preset. First, we need to choose this and choose the probe that we connected. For example, this is our probe, and these are examinations. For example, I can choose this and choose to show, or choose hide, so that it will show on the menu or not, and press save. This is a color Doppler ultrasound device, so we can choose a different mode, but when we turn it on, it runs automatically in B mode. This knob, you can see it is light, and if we want to change it to color mode, we can press this knob and it changes to color mode. There's a frame shows on the screen, and we can use the trackball to move it, and if we want to change its size, we can press set and then use the trackball to change its size and press set again, so that we can move it. And if we want to go back to B mode, we need just to press B mode knob. The next mode is PW mode. Also, there's a line shows on the screen, and we can press set to get the figures, and press B mode to get back. Apart from this mode, this device also supports BB mode, 4B mode, and BM mode. We need only to press this to turn on BB mode, or press this to turn on BM mode. This is used for heart examination, and we can turn on a 4B mode. First, please press the function key. We can see it's light, and press Q, and press it again to change a different image. The mark will change accordingly, and press B mode to get back. Under different mode, we can change its gain by twisting these knobs. For example, we are now under B mode. If I twist this, the gain here, you can see it's changing. And if I am going into color mode and twist the knob, the color gain will change accordingly. It is the same under PW mode. If we think some part on the image is too bright and some part is too dim, we can change a different part separately by the TGC module. For example, if the near field I think it is too bright, I can change the top key to the left so that this area will be darker. If I think the far field is too dark, I can change the bottom key to let it be brighter. Every time before we begin to do a new examination for a new patient, we can build a new file so that received pictures and videos could be saved into this file. please press the patient to build the new file. Here we can put its name, gender, age, and species, and informations of your hospital. For example, I give it a name of 1 and choose OK. And this file has been built. And if I want to save pictures, I need only to press this, and here shows the saved pictures. And by pressing the freeze button and press the cinema, the video would be saved here. This is a freeze button. By pressing it, the probe will stop work, and also the image will freeze. If we want to check historical images, we can press the function key and choose iWorks, and to review these patients, and we can search the files by its date. For example, if I choose all and press search, all the files that we have built before will be shown here, but now there's only one. If we needed to use DPI, we need to press a function key and choose D, and so that we can turn on the PDI mode. If we need to print a report, we can choose this to print the report, and here is the result of our calculator. And to this, we can input some comment on the report, and here we need to choose the image that we want it to shows on the report. For example, I choose this one, and press this, and choose this, and choose the preview. This report I will choose here. If I'm satisfied with this report, I can press print so that it will be printed. This part are the most common used adjustments. First, this is a filter. It is used to change the image quality to decrease the noise on the image. The figures shows on this part. If we want to change these parameters, we can also use the direction key to choose anyone, and use left or right to change it, or we can just use these fast keys to change it. Both is okay. Second is its depth. By choosing this, the scale on the right side will change, and the image will show bigger or smaller on the screen. Next is a focus. Here's an area that is moving by my twisting. Where the focus is, this area will be more sharper. Next is its angle. Next is power. We can change the power of the probe. Here, the figure shows here. By lower it can decrease some artifacts. And the volume and angle is used in PW mode. Angle is used to change the sample gate. It should be according to the angle of the blood vessel. The volume is used to change the sound of this mode. In the middle, there is a trackball. It is used as a mouth. By pressing the exit, there will be a cursor that shows on the screen, and we can use the trackball to move it to choose some parameters or pictures. For For example, I can choose this. And around the checkboard, there are some keys that is used to measure the picture. For example, we can use this to measure the distance of some organs. The result will be shown on the screen. And press clear to clear these lines and measure result on the screen. And here is another measure key. This is a professional measure items. We can choose distance, volume, and it depends on which part we choose.